Welcome to your dedicated source for health and wellness. In today's discussion, we are exploring a topic that is frequently overlooked in our daily nutrition: how specific vegetables can impact our kidney health. While we all recognize that vegetables are a vital component of a balanced diet, it is important to know that some might not be the ideal choice for your renal function. Stay with us, because after we go through the list, we will provide essential tips on managing your diet for kidney health and alternative choices that are safer for your kidneys to handle. Spinach is a nutritional powerhouse, but in the context of kidney disease, particularly among patients receiving hemodialysis, potassium homeostasis is critical. The ingestion of spinach, especially when it is cooked, necessitates caution because the cooking process condenses the vegetable's mass, effectively intensifying its potassium concentration. A practical illustration of this is the comparison between raw and cooked spinach, where a single cup of cooked spinach contains a much more concentrated amount of potassium than its raw equivalent. This is not a trivial detail, as an excess of potassium could culminate in hyperkalemia, a state where potassium reaches perilous levels in the bloodstream, posing grave risks, particularly to cardiac function. Oxalates in spinach also merit significant attention due to their propensity to combine with calcium and form calcium oxalate stones, which are the primary constituent of most kidney stones. This combination occurs when oxalates, an organic compound prevalent in various foods and also endogenously synthesized by the human body, bind with urinary calcium. This binding decreases the solubility of calcium, thereby fostering the crystallization process that leads to stone formation. Individual variability in the absorption and metabolism of oxalates further complicates dietary recommendations. A Kidney International study illuminated that certain individuals, notably those with a genetic predisposition to renal stone formation, or those who have previously formed kidney stones, exhibit an increased intestinal absorption of dietary oxalates, amplifying their risk when consuming high oxalate foods like spinach. While spinach can be a nutritious part of a balanced diet, individuals with a history of kidney stones or renal issues may want to moderate their intake or explore alternative greens with lower oxalate content. Rhubarb, with its tart flavor and fibrous stalks, is an interesting case in the context of kidney health. While it can be a delightful addition to various dishes, from pies to compotes, its chemical composition demands caution for those with renal concerns. Rhubarb is notably high in oxalic acid, which is one of the primary components of the most common type of kidney stones, calcium oxalate stones. The oxalate content in rhubarb is among the highest in the vegetable kingdom. When oxalates are consumed, they can bind with calcium in the gastrointestinal tract to form calcium oxalate, which is then excreted in the urine. In individuals with healthy renal function, this isn't typically a problem. However, in those with kidney disease or a propensity for stone formation, the high levels of oxalates can significantly increase the risk of stone development. A study published in the Clinical Journal of the American Society of Nephrology has suggested that patients with a history of oxalate stones, particularly calcium oxalate stones, should limit their intake of high oxalate foods like rhubarb. Moreover, rhubarb also contains anthraquinones, which have a laxative effect. While this may contribute to its health benefits by promoting bowel regularity, there is a potential downside for kidney health. Excessive consumption of anthraquinones can lead to diarrhea, which can cause dehydration. Dehydration, in turn, can exacerbate kidney problems by further concentrating urine and potentially facilitating stone formation. Swiss chard, with its vibrant leaves and rich nutritional profile, presents a dichotomy for renal health due to its notable constituents. Potassium and oxalates. Potassium, an essential mineral pivotal for cellular functions, is abundant in Swiss chard. While beneficial for many, this mineral's regulation becomes compromised in renal pathologies. The kidneys, impaired in conditions such as chronic kidney disease, CKD, falter in maintaining potassium homeostasis, potentially escalating to hyperkalemia, a serious electrolyte imbalance with cardiac ramifications. Research highlighted in the American Journal of Kidney Diseases advocates for meticulous potassium management in renal diets to circumvent such adverse outcomes. Oxalates, which Swiss chard harbors in significant amounts, are organic compounds that can crystallize as kidney stones. These compounds have an affinity for binding with calcium, forming calcium oxalate, the core of most kidney stones. The Journal of the American Society of Nephrology elucidates that dietary oxalates are a modifiable risk factor for stone formers, suggesting that individuals with an oxalate-related stone history may need to moderate their Swiss chard intake. Preparation methods for Swiss chard can alter its impact on renal health. Boiling may reduce oxalate levels, as these compounds are water-soluble and can leach into cooking water. However, the potassium content may become more concentrated if the chard is not boiled or if the cooking water is retained. This nuanced aspect of food preparation underscores the importance of culinary techniques in dietary modifications for kidney health. To distill, Swiss chard's health benefits are context-dependent, where its inclusion in a renal diet must be carefully calibrated. While it remains a powerhouse of nutrition, its consumption should be tailored to the individual's renal profile, balancing the need for essential nutrients against the risk of exacerbating kidney conditions. Potatoes, especially their skins, are a staple in many diets, but harbor a particular concern for individuals with kidney-related health issues due to their significant potassium content, which is especially concentrated in their skins. The outer layer of potatoes, the skin, is not only rich in fiber, but also serves as a reservoir for various minerals, including potassium. The concentration of potassium in potato skins is notably higher than in the flesh alone. This is a critical consideration for those with compromised renal function, as the kidneys are responsible for maintaining electrolyte equilibrium, including the regulation of potassium levels. When renal function is impaired, as in chronic kidney disease or in patients requiring dialysis, the risk of hyperkalemia increases. Hyperkalemia can disrupt normal heart rhythms and is associated with significant cardiovascular risks. The relationship between potassium intake and renal health is underscored by studies such as those reported in the Clinical Journal of the American Society of Nephrology, which indicate that managing potassium intake is vital to avoid the cardiac complications of hyperkalemia in patients with advanced renal disease. Moreover, potatoes, when not prepared properly, can contribute to an increased intake of potassium. For instance, boiling potatoes can lead to a leaching of potassium, which may decrease its content, but frying or consuming potatoes with their skins on retains the majority of potassium. This preparation factor is pivotal in dietary planning for individuals with kidney concerns, where the method of cooking potatoes can make a significant difference in the dietary potassium load. Tomatoes, renowned for their vibrant hue and culinary versatility, are a favorite ingredient in countless dishes. Nevertheless, for those managing kidney health, tomatoes present a unique nutritional challenge due to their substantial potassium content. Potassium is an essential mineral crucial for fluid balance, nerve signaling, and muscle contraction. However, in the landscape of renal health, the intake of potassium requires meticulous regulation, as compromised kidneys have a diminished ability to filter and excrete excess potassium. This can lead to hyperkalemia, characterized by high levels of potassium in the bloodstream, which can precipitate serious cardiovascular complications, including arrhythmias. Research published in the Journal of Renal Nutrition emphasizes the importance of dietary potassium management for individuals with chronic kidney disease, highlighting the need for vigilance around the consumption of potassium-rich foods such as tomatoes. Tomatoes themselves are not significantly high in oxalates, which are more commonly associated with kidney stone formation in foods like spinach or rhubarb. Thus, the oxalate content in tomatoes is not the primary concern. Instead, the focus for kidney health is their potassium level, particularly when tomatoes are ingested in concentrated forms like sauces and purees, which contain a higher potassium density than their fresh counterparts. In light of this, nutritional guidance for those with renal insufficiency often includes recommendations to limit the intake of tomatoes to avoid the exacerbation of hyperkalemia and its associated health risks. It is imperative for those with kidney concerns to consult with healthcare professionals to tailor their dietary patterns appropriately, ensuring their meals are supportive of kidney health while still enjoying the flavors they love. Have you ever wondered why some people seem to avoid kidney stones, despite a love for spinach, potatoes, Swiss chard, rhubarb, and tomatoes? There's a whispered secret in the corridors of nutrition science that might pique your curiosity. It's not just about eating less of these oxalate vegetables. It's about the company they keep on your plate. The unassuming presence of dairy products like yogurt or milk at your meal can be a game changer. These dairy delights have a clandestine affair with oxalates, binding with them in a way that prevents their accumulation as kidney stones. Remember, everyone's nutritional needs are unique, so it's crucial to consult with a healthcare professional or a nutritionist for personalized advice. If this deep dive into renal health has changed the way you look at the vegetables in your pantry, please subscribe and like the channel. We are dedicated to uncovering the vital health truths that are often buried or ignored. Protect your kidneys and cultivate a healthier future. The next treasury of wellness insights will be opened soon.